was the last menstrual period. Sabi niya, ay Mrs., paano ko malalaman kung buntis ka kung hindi mo alam ang LMP mo? And then this woman patted him, Iho, maniwala ka, buntis ako. So in other words, you know, we kind of became parang automated. No, we know. And then one of the things that really I realized that we were so insensitive was when this woman was lying spread-eagled actually with stirrups on the stirrups, and the mother was there, and the mother was berating actually the resident, the OB resident, because the OB resident was insisting that the daughter actually had an abortion, and. How can that be? The mother said, my daughter knew no man. Parang si Virgin Mary, you know. And so they were, the resident and were fighting. And you can see that the resident also wanted to make sure that she won the discussion. And as I was looking, and we were grinning actually, because already fetal tissue was coming out. And so, panalo kami, doctor. But you can really see the embarrassment of the mother, and then the daughter just turned around like that with tears. And I realized that we were just there, it's just one of those things. And we were totally insensitive about patients' predicaments and privacy. So those are the kind of experience, I think, that makes one realize that so many things actually can be taken for granted. So I had my residency in internal medicine in the medical city, and that's where I spent my internship. And you know, I was so unfortunate, maybe looking back, I'm fortunate, that my first day, on my first year as a resident in medical city, I was given the rotation of neurology. And my first patient, the only patient, was a VIP patient staying in the most expensive suite of the medical city. And you know, when you are in a most expensive suite, you know, you kind of don't want to go in because you have to ask questions and then examine the patient. And the patient was an industrialist, very rich. And the daughter was somebody who eventually became a senator. So, you know, there are differences, no? When you deal with the very rich, they are nice. When you deal with just the rich, sometimes they're not so nice. But I was scared, but they were okay, and I tried to make a good history, tried to get a good history, because the consultant was the most feared in the hospital. He was, you know, his reputation preceded him, and I was so scared of him, no? And well, it turned out okay. He started reading my notes, and he started actually interpreting my penmanship. He was reading my character through my penmanship, and well, it turned out to be he was a very decent man. He was the one who told me that, you know, that other resident, she's going to make a good wife, and that's the woman that I married, actually. So the consultant eventually became the Department of Health Secretary. So during the time in my neurology, the first one, I was so inspired that I thought I was going to no longer be a surgeon. No? I was going to be a neurologist. And because of the fact that the medical city is a private hospital, we needed, for the accreditation of our training program, we needed what you call charity exposure. So we needed to have that at the Canlubang Industrial Hospital. And during the time, I was so comfortable, you know, I was a pseudo-neurologist, and there was this guy who was actually a driver of the family, or the owner of that estate. And it was a simple, uncomplicated stroke. I mean, it's something that I thought I could handle, okay? And I was going to handle that. This was my first case. But the family insisted that the patient should be driven to the medical city. So I was so disappointed. I wrote Dr. Bengson. And I said that this is the way it's going to be. I felt so comfortable with Dr. Bengson already at that time. I would write him notes, and I keep all his answers. I said, if this is the way it's going to be, that every time a case that I can handle has to be referred to the hospital, to the medical city, what's the point in training me? And he was so nice to answer. He says that, I am sure you can confidently take care of this patient, except that it is not entirely dependent on you. Because patients also and their families have other fears that you have to consider. And it is not just because you think you can do it that they will just have to agree. No? And so those are the kind of things that I learned in my, and I just want to emphasize this because I think when we train doctors, we need to make sure that we have people who can inspire. No? And that's why I always have this know about Dr. Bengson, because he is so well-rounded. He talks about other things, and he asked me actually one time whether I pray. So I thought that was a good man. You know, you're asked whether you pray. Well, let me see. Right after my medical city residency, I proceeded to PGH, UP-PGH. And you know how it is with UST and PGH, no? Well, medical city is basically UP-PGH. And the consultants there were always talking about UP-PGH, you know? And I felt so, you know, parang second class, UST. And I said, maybe I should really, ano tong UPGH, I should give it a try. And so I applied for my cardiology fellowship training program in PGH. Well, what did I find out? I found out that, well, there are so many indigent patients there. Very, very many cases for learning. I also found out that they have the atmosphere where they can express themselves. But at the same time, I also found out that maboka lang sila. Madaldal. Eh sabi ko, mayabang sila, mayabang din ako. Pareho lang kami. So I felt very, very at home in PGH. No? Now, one of the things that I could not really understand, however, was coming from where I came from the University of Santo Tomas, and from the medical city, which is a private hospital. I was just taken aback one time when I heard somebody actually cursing, you know, the bad word. The four-letter word, cursing somebody inside the ICU. And when I took a peek, it was actually a resident, a medical resident, actually cursing a patient in the ICU bed. And I couldn't take that. No, I realized, wow, how could this be? And also one time, you know, in the emergency room in UP-PGH, there are just so many people there. Some people die on the stretcher, not even being attended to. That's the kind of cases we have there. And you have now doctors trying to cope and not coping very well, and actually nagmumura, minumura yung pasyente. No? And I felt that that was something that I could not really fathom. That is how I started to really mold myself. That I realized that I have to be appreciative of how patients are, no? And I was lucky after my fellowship. Lucky in a sense because, you know, in fellowship you start your practice and then you start to get married, things like that. I thought I was ready to start a family, and I was lucky I was taken in by Bristol Myers Squibb. That's a multinational company. I was taken in because they like, I was a speaker for them as their medical director. When I was medical director, that was 1988-89, Dr. Bengson was already the OH secretary. And the first bout that I had was with industry was that as medical director, I was supposed to take care of the clinical trials and all the regulatory documentation and things like that. And that was the time that the pharmaceutical